There are more people with the flu than there are people with the coronavirus. The difference between the two, as we've talked about before in other sessions and as Dr. Fauci and others have discussed, is the coronavirus is easier to spread, and as we collect more and more data, that's becoming very clear that the coronavirus spreads more easily than the seasonal flu does. So there is no question about that there are more people right now with flu infection and have been over the course of the flu season than there are people with the coronavirus infection. That does not change the fact that we are concerned as we watch how quickly the coronavirus has spread. And the reason we've been out here for the last several weeks is because we are concerned about this new virus. One of the reasons we're concerned, and we've mentioned this before, is unlike with the flu, for which we have a vaccine to minimize how many people become infected, we don't yet have a vaccine for the coronavirus. We're doing a lot of great work on that and happy to talk about that at a follow-up session. We also don't have medical countermeasures for the coronavirus like we have for the flu. So you can go out and you can get Tamiflu from your pharmacy, from your doctor, if you have the flu. That shortens the duration and the severity of the infection. We don't have similar drugs yet. We're doing a lot of testing on a lot of drugs, both in this country and with other partners, so that we can identify whether there are drugs that will be similarly effective for coronavirus infections. But right now, we don't have those. And so not having those measures is one of the reasons that we are paying a great deal of attention to this, because we don't know exactly how this is going to unfold. We still don't know if it's going to be seasonal. Best case, it may prove to be seasonal, and this is going to start tapering off. That doesn't seem to be happening right now, but that's part of what we are also watching. It's a known unknown, if you will.